Everyone, thank you for joining us for this interview with Erik Soiferman. Dr. Soiferman founded Liberty Urgent Care. He's the CEO and founder of a growing hybrid model urgent care Occ Med group near Philadelphia. And so I'm going to talk to Erik here a little bit and ask him what his experience has been with OccDocOne. So Erik, so far, in generalities, what's your experience so far?
Uh, it, with OccDocOne, it's one of those tools that every time you use it, you realize how impressive it really is. When we first started using it, we kind of dipped our feet in the water, and now it's become an integral part of training and bringing on any new provider, any new practitioner. We use it as a marketing tool. We use it to tell our clients that we have a straight protocol, and the depth of the information that's in there is astounding.
Great. Okay. So from the provider side of things, you mentioned training. What are the providers saying about it, either in their training or as they use it?
So the most important thing to me, at least, is the idea of um, the every different employer has their own kind of little niche of they want this, they want that, they want to see this, they want to see that, and they're all a little bit different, but they want the same information in different ways. By being able to say, hey, we've got this great program that gives us a protocol, and this is what we're going to do, and I'll be able to tell you what's on visit 2 and visit 3, and they understand that this is designed to avoid the recordables and all of the pros that OccDocOne gets you. So we teach that before we had OccDocOne, we would educate the providers and we would say, look, we want to avoid recordables. We would teach them about a recordable. We would tell them to this, but the exams weren't necessarily standardized. The report wasn't necessarily standardized. What one doc would do on visit 2 wasn't necessarily what another doc would do specifically on visit 2. This allows us to say, hey, read that, open that. It tells you word for word what to do, what to document, what things you're going to say so that you don't miss something. And it just makes it uniform across the board, which it has made it so much better for us to relate to the employers, because they know that no matter which doc is going to see the patient, if we try to get consistency, but in an event that we can't, they know that the docs are all following OccDocOne, and so they all have a straight roadmap to get to the same endpoint. For that alone, it's just absolutely just changed the way that we practice.
Great. Okay. So how would you describe your experience relative to injury capture, revenue capture, using the tool? Obviously, injuries involve a higher level of compensation, et cetera. What's your experience with that?
So again, it's really all in the beauty to me of OccDocOne is the guidance that it gives you. Never mind the depth of information that's there, where you can look up anything and it teaches you all about it with the videos and the information, but the uniform guide of do this on visit 1, do this on visit 2, where before, we would see a fracture and the employer would say, all right, well, send them to the orthopedist. Well, no. We can put a boot on them. I happen to have physical therapy in one and going to be 2 of my own centers. So we know when to order the MRI, and we can keep that in-house. So it generates the follow-ups. By utilizing the protocols in OccDocOne, one of them tells you when the next visit's going to be. And so we say, we're going to see this patient, we're going to follow this protocol, but that's going to keep them coming. And they say, okay, no problem. So it not only helps us to generate visits, but it helps us to keep the patients in our own system rather than losing them to orthopedics, which is then going to lose them for physical therapy. And, we may not see that patient again, or once orthopedics clears them, the employer sends them back to us to just write okay, they're good to go back to work letter. This keeps them in our system, and it really has made a change.
Right. Anything on the urgent care front that you've seen too, as far as injuries coming in from urgent care?
Yeah, well, it's the same thing. I mean, an injury is an injury, whether it happens from work or whether it happens, playing hockey or playing sports, you're going to manage it the same way. So, we use it as a resource. It's called OccDocOne, but really it's, injury care. And it's one of the things that we are stressing to our providers, and even our medical assistants. They know about it, and they've utilized the tools of how to put splints on, how to put slings on, how to do all of those things just as refreshers. But you can utilize it in any injury. It's not just an occupational injury. And so it's a true resource for urgent care / injury care.
Great. Anything that's a surprise to you, something you weren't expecting that you found in there, or some of your staff is utilizing in a certain way that was a surprise to you?
To be perfectly honest with you, I think that, and I mean this, the surprise is really how much is in there. For example, I don't see patients clinically very much anymore. I'm doing mostly administrative. But the other day, I needed to look something up for DOT. So I hopped into OccDocOne and I just sort of said, okay, what's in there? I had no idea how much was in there for DOTs. You really don't understand the depth and the breadth of everything that is in there. It's comprehensive isn't the word. And so the surprising really is how much you can use it for, and understanding and realizing that if you're not sure where to go, chances are there's something on OccDocOne that has what you're looking for.
Great. Well, thank you so much, Eric, for your time today. I appreciate it, and I'm excited about your success as you grow your sites and work the hybrid model so that you're getting a chance to take care of those injuries and keep that in-house, so that the local orthopedic urgent care competitor might not be quite as successful in their endeavor to do injury care that we should be doing in our urgent care center. So thank you so much, Eric. I appreciate it, and we'll be talking to you soon. Okay, take care.
My pleasure. Thanks, John.